to see youth being able to enjoy the performing arts in a safe way and getting back to normal and having a great summer and being able to do it without putting yourselves at risk. Kids of Summit County, great job! I'm really happy. My daughter is able to, she's in a camp this week. She does visual arts in Boulder. She did a camp last week too, and I'm really excited that kids are able to be in summer camp. And also, it's really good learning and practice for what school's gonna look like this year. So we're gonna be doing a lot of this distancing work during the school year too, to keep everybody as safe as reasonably possible, while still making sure the kids get the education, of course, you need in school, but also really all of the enrichment activities that you're accustomed to. So thank you to the Performing Arts Center and to Summit County and to Josh and to the whole team for really doing a great job here. We have a number of healthcare related bills, really great bills that save people money on healthcare, that make it more convenient to access telehealth. A number of really good bills here today. The first has a long name. It's called the Health Insurance Affordability Enterprise. Basically, this is the program championed by Representative Kennedy, Representative McCluskey, we're in her home county, Senator Moreno, and Senator Donovan, that saves people money on health care. In fact, it saves people around 20%. It reduced costs about 20% on health care in the individual market, which is the one that the state policies most directly affect. The biggest market is people who get it from their employer. Those are private negotiations between employers and insurance companies. There's some state policies that can help reduce costs. Even the telemedicine one we're signing today can help reduce costs in that market because it gets passed along to consumers. But the one that we have the most influence over is the individual market. And this bill we're signing today locks in the 20% savings for 5 more years. And in fact, here in Summit County, thanks to the work of the Peak Alliance, and Tamara's here as well, those were savings of over 40%. Senator Faith Winter is with us as well, Representative Dylan Roberts, a number of others on the other bills. But first, to talk about reinsurance, I want to introduce our legislators who sponsored the bill, and I want to thank the Lake Dillon Theater for hosting this event, for giving the kids an opportunity to show their great work to members of our state legislature from both parties and the governor. Thank you. And with that, I want to turn it over to Representative Kennedy to talk about this important work that saves residents of Summit County. I believe it was 47% on their healthcare premiums last year. They had some of the highest in the state. The average across the state is 20%, but essentially, the higher your rate was, the more it saved you. So in Western Colorado, the rates were higher, the savings were more. In the Front Range, the savings are around 15%, still very substantial in the individual market. One more acknowledgement, two members of my cabinet are here. Dan Gibbs from Summit County is with us. And our insurance commissioner, who's played a key role in helping the legislators have the information they needed to write this legislation, Mike Conway, is here as well. We'll turn it over to our legislators.
Well, good afternoon. Thank you guys all for being here. My name is Chris Kennedy, and I represent a district in Jefferson County, and I'm really honored to be here for the signing of this bill today. I've been working on reinsurance policy for 4 years now. In my very first session in 2017, I was one of the sponsors of the bill that put in place the very first actuarial study to start assessing the feasibility of this program. And 2018, I tried to implement a bill. It didn't work. Last year, Representative McCluskey carried a bill that put in place the beginning of this program. And this year, I'm really proud of the work we did to continue it and solidify the funding stream. Now, Governor Polis spoke to the importance on the individual market, but I want to speak just for a moment to the importance to the structure overall, because the individual market, as we know, is a smaller percentage of our overall population. And so I certainly hear from other people in my district, well, what have you done for us? And my answer is, with this bill, we are stabilizing the entire insurance market. When we increase the number of people enrolling on the individual market, both through the reinsurance program, through the new benefit that's going to exchange to undocumented persons and people that fall into the family glitch, we're going to dramatically increase insurance enrollment. Maybe the commissioner will want me to back off the word dramatically, but nonetheless, there will be a really positive effect on total enrollment, which is going to stabilize prices and reduce cost shifting into the other markets. So I really believe that this is maybe the biggest thing we can do in Colorado to make sure we have affordable health insurance for everybody, and we're going to keep on working on it. So thank you so much. With that, I think, are you next? I'd like to introduce my good friend for many years, Senator Dominic Moreno.
Good morning, I'm Dominic Moreno. I represent Adams County in the state Senate, and just want to thank the young people for the beautiful performance. Thank you for explaining reinsurance through interpretive dance. It was gorgeous. This bill is so incredibly important, and honestly will truly transform healthcare in Colorado by bringing down costs, expanding coverage and access to more people. That's what we should endeavor to do with our healthcare system. And so I'm just excited that more folks will be able to buy into healthcare because they can finally afford it. And I think this is a great piece of legislation that will move our state forward. So I will turn it over to Summit County's own Representative Julie McCluskey.
Thank you, Senator. And it's so good to be home. Hi, everyone. Yay! Away from the Capitol and in the beauty of Summit County. I first want to start by thanking some real champions of the reinsurance program that came into being last year. Our very own Dan Gibbs, who years ago started down the path of trying to find affordable health care for all of us who live here. Tamara Pogue, who now runs the Peak Health Alliance and sat at that table with Dan and invited me to join at the point that I decided I wanted to go serve this community in the way that I do. I'm particularly grateful to Senator Dominic Moreno, who I think there was a little bit of arm twisting, if I remember correctly, to get him to champion this bill in the Senate, and he did with such grace and passion that we were able to get it over to the House. And ultimately, I really want to thank my partner, Representative Chris Kennedy. Without him, I would not know as much as I do about healthcare, and some days that's better than others. And I would not be standing here before you with a program that really does make a difference for the people on the Western Slope. 3 years ago, when I decided to run for office, I talked to people on their doorsteps and in their communities, and the number one issue, the number one challenge they faced was finding affordable health care in the community where they live. I am so proud of what we've been able to do with reinsurance. The fact that this year, this model will help expand coverage for families and for those that are undocumented in our communities. And I am so proud that that ongoing sustainable funding is now ours for 5 years. That tees up the really great work that we have yet to do, particularly around the Colorado public option. Yes. And I'm excited to say that Representative Roberts, who's out here, come in, and Representative Kennedy will be leading that charge next year. So watch for more on the healthcare front. Thank you all again for being here. Thank you for your support. And with that, I'd love to thank one of our many amazing coalition members, and I should pause just to thank all of them. We've got folks here from CCHI, Colorado Children's Campaign, Connect for Health. I don't remember everybody else who is here. Calor is here. Yay, thank you. And we've also got CCLP. Allison, I think you're next to speak. So thanks, everyone.
Good morning, everyone. My name is Allison Neswood. I'm the Deputy Director of Strategic Priorities at a policy organization called the Colorado Center on Law and Policy. And I'm really thrilled and honored to be part of this celebration today. This legislation will continue our state's march toward affordable health coverage for everyone in our communities. As people spoke about, it will continue our reinsurance program, which has significantly reduced premiums statewide. On top of that, it's going to provide targeted subsidies so that low and moderate income Coloradans can better afford health insurance coverage that will safeguard their health and their financial well-being. I'm really proud of this legislation because it makes strides towards closing persistent coverage gaps that prevent Colorado families from accessing needed health care. including gaps that impact our immigrant communities, our hardworking immigrant families, many of whom are really struggling the most during this crisis. Providing coverage options for Coloradans left out of the ACA and other health coverage programs is critical to their health and well-being and the health and well-being of Colorado families, of the Colorado families they're supporting. Health coverage that is comprehensive and affordable promotes physical and mental health by providing financial security and allowing covered persons to seek the care that they need. For people with low incomes, just having health insurance reduces rates of depression, eviction, and bankruptcy. And kids in low-income families who have publicly financed coverage are more likely to finish high school, graduate from college, and have higher incomes as adults. In addition, investing in our uninsured families is right for our communities as a whole. As we face the COVID-19 outbreak, it's more apparent than ever that access to comprehensive health insurance for every individual is essential for the health of our communities. Senate Bill 215 represents historic progress towards the goal of covering everyone in Colorado. And I really want to thank the governor's office for their leadership on this issue, thank our sponsors for their great champion of this policy, and my partners at the Colorado Consumer Health Initiative, Colorado Children's Campaign, Colorado Organization for Latino Opportunity and Reproductive Rights, Healthier Colorado, Connect for Health Colorado, and others that really partnered with our bold state leaders to bring this policy to fruition for our state. Thank you.
It's official. Congratulations. Really important bill. Next bill is about telehealth, telemedicine. I mean, what's not to like? It's more convenient. It's safer because you don't have to put people at risk of contracting COVID by going out. And it saves money on healthcare. So what's not to like? I want to thank Senator Winter, Senator Tate, Representative Lantine, and Representative Soper for their amazing, important work on this bill that's particularly beneficial to rural Coloradans who might have to travel far to get the expertise and the consultation that they need for their condition. So thank you for embracing telemedicine. A safer, more affordable healthcare is around the corner, and I'd like to turn it over to the sponsors. We'll start with Senator Winter.
Governor, and thank you, Summit County, and to the kids, your dance was amazing, and I very much enjoyed it. And thank you to everyone that's worked on this bill. This is an incredibly important bill, not just in terms of responding to COVID, which clearly that had a big part to do with it. When we told folks to stay at home, they did stay at home. And sometimes they did that at the expense of their health. Getting regular checkups, talking to doctors about different symptoms. And this is a way that people can access health care and stay in the safety of their home. But it's also access for folks in rural Colorado who oftentimes have to drive for hours for weekly visits through incredibly bad weather. That increases access, and this is access for those with insurance and also on Medicaid. And it's working incredibly well in a variety of different sectors. One particular family had an incredible breakthrough. Their 5-year-old daughter was receiving twice a week physical therapy and occupational therapy appointments. And during coronavirus, those appointments got canceled. And she could have lost all of her great work she'd been doing for the past couple of years on physical therapy and occupational therapy. Instead, she accessed it through telehealth. And this little girl, Anna, while we were on lockdown, she learned how to cut with scissors. She learned how to walk up and down stairs by herself because of the great OT and PT therapy she received over telehealth. I can't wait to see where this goes and how this increases access to healthcare for all Coloradans. And thank you to my incredible sponsors that worked on this with me. And with that, I'll have Senator Jack Tate come up and talk a little bit about this bill.
Thank you, Senator Winter. Thank you, Governor. Thank you, Summit County, for hosting. Technology is an incredibly beneficial and disruptive force. Think about our lives today. How many people heard of Zoom 6 months ago? I never have. But telemedicine and the ability to use technology is so powerful in connecting patients to providers, in a way that's safe and convenient and expands access. I look forward to technology having a more important role going forward in the healthcare system, and this legislation's very, very important. It deals in some ways with the financial aspects of the provider-patient relationship, making sure that telehealth is a viable medium for providing care going forward and is not disadvantaged versus other forms of interaction. So I'm glad the state of Colorado is embracing technology going forward, and thank you, Governor, for your strong support of this initiative.
Sorry, Governor. Hi, welcome to Summit County. Thank you so much. And kids, thank you for that great song from Moana. That's one of my favorites, and you're welcome. I appreciated it so much. I am one of the House sponsors of the Telehealth bill, and it was so exciting to do that. And I have to be honest, it was brought to me by some really great folks who are in home health. Betsy Marie is one of those folks, and I see her standing there. And I just want to give a shout out to Betsy because she has been lobbying at the Capitol for 35 years on a variety of healthcare issues. And this is her last session and her last bill that she worked on. And so it was a great honor to work with Betsy. I've known her before I was even elected. So thank you, Betsy, for all your work on that. Telehealth is important, and it was important in making sure that folks had continued access during our Safer at Home. It made sure that folks kept up as best they could with their health care visits. I have a grandson on the autism spectrum, and he was able to continue his OT and PT visits by a computer during our stay at home. And without that, he would have fallen further behind and certainly couldn't afford to miss that. I'm so grateful that he had that ability to stay on top of that, and I'm so grateful that we're going to be able to continue that and make sure that our providers are taken care of on parity with real-time visits, which is really the best way to make sure that we continue to use telehealth. So it was an honor to be a part of this. Thank you so much for being here today and for welcoming us. And our next speaker is my House sponsor, Representative Soper.
Well, thank you. And thank you, Representative Valentine. And thank you, Governor, for coming out to the West Slope to sign this. I also just wanted to recognize my wife, Sarah, who came up with me today. But think back to March 9th. I was in the hospital having hip surgery, and I was going to sneak out of the legislature for 1 week. And then on March 10th, early in the morning, I was still in the hospital, and I get a text message saying we're going to go into a state of emergency. And my first response was, for what? That's just kind of how far off the radar it was. And then later that morning, my doctor came in and he said, Matt, we're going to utilize telehealth. And I really didn't know what that would mean. But I discovered through both a phone call session with my doctor later on and then a video session, the power of telehealth. And it's just one of those things that I don't know why we didn't utilize it before we had to go into a pandemic. But this is really the silver lining of the COVID-19 pandemic, was discovering that we can, in fact, utilize this technology. So thank you, Governor, for signing this bill. And I'd like to recognize Darcy Peacock, who's with Solus Home Health next. Thank you.
Good morning, everyone. My name is Darcy Peacock. I am the CEO of Solus Pediatric Home Health Care. And it is such a pleasure to be here this morning representing all of our fantastic occupational, physical, and speech therapists and employees, as well as the wonderful families we serve. I'm also representing the Home Care and Hospice Association of Colorado that has done tremendous work alongside our legislature and under the leadership of Governor Polis to pass this bill protecting patients' rights to receive care via telehealth. Amidst this uncertain time, Colorado has taken this opportunity to break down barriers, be creative in communication and service delivery models, and increase access to our most vulnerable population without increasing risk. The field of home care, home health, and hospice has banded together to demonstrate that clinicians, caregivers, and nurses can remain a consistent force during these troubling times, supporting our community through virtual visits just as effectively as we have been in person. This has pushed the historical boundaries of the home care field and has illuminated the significance of telehealth far beyond a global pandemic. Let me share the level of impact telehealth has on the families we serve. Telehealth has allowed immunocompromised children like Eli to participate in live virtual sessions to reach critical developmental milestones like crawling and feeding without increasing risk of illness even during flu season. Telehealth means that children like Grace can work with a pediatric physical therapist from a different county who best meets her needs to help develop the leg strength necessary to walk independently and play with her friends outdoors. Telehealth means access to behavioral interventions for Atano, whose mom has been able to take the driver's seat in therapy and significantly reduce his aggressive outbursts by learning how to encourage him to express his feelings and needs. It means that when we hit the snow season, which so many of us love, patients don't risk losing progress when there's inclement weather. Telehealth is healthcare and treatment and access. And I'm so proud to see that our world of home care, home health, and hospice is turning obstacles into opportunities, and even more proud that we're using this time now to make necessary and lasting changes to healthcare access for years to come. Thank you.
Thank you very much.
The next bill, who doesn't like things to be as easy as possible, right? This bill makes it easier to enroll in healthcare insurance because a lot of folks, when they fill out their income tax report, they might not realize that they actually are entitled to a subsidy for their healthcare. Maybe even they get it for free through Medicaid, and yet they're not enrolled. So this makes it easier to enroll. I want to thank Representative Lontine, Representative Perry Will, Senator Jack Tate, and Senator Jeff Bridges. And we'll begin with Representative Susan Lontine.
Thank you, Governor. It's been so long since I addressed y'all. This was one of my favorite bills ever to work on. And thank you so much to Allison Nesswood, with whom this bill would not have been possible, as she did all of the work behind the scenes with all of the different departments that made this look so seamless. It's so great that we have the ability for folks to find out when they file their taxes what they're eligible for health care and coverage, so that they can take advantage of everything that they can. If they're eligible for Medicaid, for CHIP, or for any of the subsidies on the exchange, they can find out immediately through the tax filing process and get enrolled in the coverage that they are eligible for. This will expand everybody who's covered. It is so unbelievable to me that we have so many people who don't know what they're eligible for and don't take advantage of what they're eligible for. This way we can make sure that everyone knows what they have available to them and can take advantage of that, and make sure that they have coverage, which is so important in this time, and continuing that they have continued coverage for health care. So I'm so excited to work on this bill. It was a great bipartisan bill. I wish that Representative Will was here. He was a great partner. But I'm so happy that Senator Tate is here. And I think that you are next to speak, Senator Tate. So
From the Coalition of the Willing.
the Coalition of the Willing. So thank you, Senator Tate.
Thank you, Susan. And just to emphasize what she said about Allison and other stakeholders on this bill, just like the last bill, all legislation is so many people busily working hours and hours, and then folks like Susan and I swoop in at the last minute and take the credit sometimes. I just really appreciate being able to be part of a solution aligned with my view of government, which is we should be making things easier, not harder. And this is one of those legislative initiatives that makes things easier for Colorado residents to get matched with healthcare, the healthcare programs we have in the state. And thank you, Governor, for your support of this bill.
Okay, we're ready.
It's official. Congratulations.
Yay, thank you, Governor.
Senator. I also want to acknowledge we have Grand County Commissioner Rich Cimino is with us. Where's Rich? There you are. Thank you, Rich. And we have Summit County Commissioner Elizabeth Lawrence. Where's Elizabeth? Thanks for joining us. You know, this next bill allows Medicaid buy-in program after age 65, and I want to thank Representative Lantine and Senator Tate, and along with Senator Fields, for their bipartisan work, as well as the Colorado Cross Disability Coalition. You know, Medicaid is a great program, but until the passage of the Affordable Care Act, it actually held people back, because once you earned above a certain threshold, you lost your health care and you couldn't afford it. What the Affordable Care Act did is it put in place a system where instead of losing it, you get subsidized as you earn a little bit more. So you're actually encouraged to work more, to get off of relying on government, to get back on your feet, and to be able to afford your own health care and pay more as you earn more. This bill is very much in the same spirit as the Affordable Care Act. What it does is it provides a way that people who turn over 65 can continue the buy-in program for Medicaid. It's a way that ensures that people that are living with disabilities don't have to keep their incomes artificially low. They're encouraged to earn more, to work as much as they can, to get back on the feet, to better their lives, to become self-dependent. And this bill is another step in that direction, just as the Affordable Care Act was. Nobody wants to rely on a handout from government. People want to be able to get on their own 2 feet. And just as the Affordable Care Act helped people do that, this bill does too, by making sure that people are still eligible for the buy-in program after they turn in 65. There's a lot of people over 65 that work, and some of them have to, and some of them want to earn that extra money to go on vacation or help their grandkids go to college. Whatever the reasons are that folks in their late 60s and 70s want to work, they shouldn't be penalized for wanting to work and earn money. And this bill will help that occur for those with disabilities. I'll turn it over to Senator Tate, and I want to thank Senator Tate, Representative Lantine, and Senator Fields for their really important work on this bill.
Thank you, Governor. This was my pre-filed bill, which means this is the first bill I filed this last legislative session. And I'm so grateful for your support, Governor, because with the pandemic, there's a lot of chaos in the legislature, and it's hard to know what bills would end up making it to the finish line and which ones wouldn't. And your leadership on this bill, along with Representative Lantine, really made this important priority come to fruition today. And as the governor said, people have jobs, people have businesses, they're investing in their retirement, saving for their retirement, their lifestyle, their livelihoods. Why not keep them going if that's what they're, what's in their plan? So thank you, Governor. I appreciate your support.
Thank you all again. Before I begin to talk a little bit about this bill, I just wanted to acknowledge Senator Tate. This is his last session, and I was so honored to be a sponsor with him on these 3 great bills. He's been a wonderful, wonderful partner, and I want to thank you for your service to the state, Senator Tate. It's been an honor to know you. So just wanted to give a shout out to Jeff there. This is a great bill that Senator Tate started in the Senate with the help of an advocate from the Colorado Cross Disabilities Coalition named Julie Riskin. Julie isn't here, but she would say that the original buy-in for folks with disabilities on Medicaid didn't foresee that any of them would live past the age of 65. And so now that we have access to better health care and people are living longer, people with disabilities are also living longer, but they were being penalized by needing to stay on the Medicaid even when they still continued to work. And many of them have to work, and some of them really want to work. When I think of an advocate as passionate as Julie, I don't see her stopping when she's 65. Nothing's going to stop that woman, which is great. And so this is a great bill. Senator Tate did a lot of the legwork in the Senate and handed me a great bill to cross the finish line in the House, and that was an honor to carry it. So thank you all. And thank you, Governor, for your support today.
Thank you a lot. It's official. Congratulations.
Thank you.
Senator, congratulations. Is this your last signing? Oh, that's going to be exciting. Congratulations. Thank you, Summit County.